Okay, welcome everyone. Thank you so much for joining us. I'm April Harrington, the program manager of the Chicagoland Healthcare Workforce Collaborative. We are here today with um, with our Career Pathway Programs Across the Nation series fourth event, Boston Hospitals Recruit and Train with Condensed Curriculum International. If you haven't already, please introduce yourself in the chat so we know who's joining us. I think many of you are CHWC partners, but in case this is your first time, we are an employer-led collaborative led by Chicago's main health and hospital systems and joined by our strategic partners, including training providers, workforce development organizations, funders, and other stakeholders. And we are all here to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations in our region, and also address the ever-evolving needs for talent in our sector. Here is a little taste of the hospital systems that we are led by, and we have over strategic partners that join them in our peer learning space. We are primarily a peer learning group, but we also do a little bit of research and a little bit of direct programming. Check us out at shyhealthworks.com for our events. We have a few upcoming events I'd love to share with you. We have a learning event next week with the University of Illinois Chicago Center for Healthy Work. They have done some really interesting research with a mid-Atlantic health system on their workforce health practices. They're looking at the employee data, such as retention and health data, and matching that up with some of the workplace policies that they've put into place to support their employees. And they have some really interesting research with the results. And they also want to continue doing some of that research in Chicago and find new partners. So I encourage you to join to learn from that research and also see if you might want to partner with them in the future. Then we also have our first quarterly meeting of the year on March 4th. That's from 8:30 to 10 a.m. on March 4th. Our agenda is listed on the website, so you can register for that there. It is a virtual meeting. And then finally, there is a public health collaborative meeting in March as well on March 13th. If you are not already engaged with the Public Health Workforce Collaborative and you'd like to be, just shoot me an email and I can connect you with Anna Yankelev, who runs that collaborative. This is our fourth in our career pathway programs across the nation series. Something I know from our employer partners and particularly our steering committee is that you all value really learning what's happening elsewhere in the country that we might not be trying out here in Chicago yet. So that is the purpose of this series, is learning from folks in Boston or in North Carolina or in other regions. These programs often feature a particular partner that we could also start working with in Chicago, like today's program. So hopefully we'll learn today about what's going on in Boston, but also have the opportunity to learn about some partners we could work with in Chicago, which brings us to today's program. We have Amy Roberts from Condensed Curriculum International, joined by Sean Stowers, who works for a partner organization of We Learn. They'll explain the relationship. And they have been working with a group of folks in Boston, including UMass Global and Mass General Brigham, to build a ready-to-work program. This is grant funded. It is a large program that has achieved fantastic results with over 750 job placements so far in in-demand roles, including medical assistant, patient care techs, and surgical techs. So I know there's so much that we can learn from Amy and Robert. I'm sorry, Amy and Sean, Amy Roberts and Sean Stowers. But I'm also very happy that Reagan Forlenzo is joining us to bring in that employer training provider perspective from the Ready to Work program at Boston. So I'm going to stop sharing and allow Sean to take over for me. Please, as they're presenting, feel free to drop questions in the chat. But we're a relatively small group today. I know there will be plenty of opportunity for you to come off mute and ask your questions and participate in some discussion later on. As always, this is recorded and will be uploaded to our website tomorrow along with the full slide deck. And if you're registered, I will email you the link to the recording and slide deck as soon as it's ready. So with that, take it away, Sean.
April, thank you very much. And just, I know we did some introductions. So my name is Sean Stowers. I'm with WeLearn. WeLearn is the corporate facing arm of Condensed Curriculum International. I'm actually super excited to be talking to you all today because I am based in Chicago and I don't always get to talk to folks in Chicago. I am joined by my colleague, Amy Roberts with Condensed Curriculum International. For those of you who do not know CCI, CCI has been working with colleges, universities, workforce partners since the late 1990s to provide curriculum solutions to develop allied health professionals. And so we have a long history in this space, and we could not be more excited to be joined by our friend and colleague, Reagan Forlenzo, who's the Director of Corporate and International Education with UMass Global. UMass Global is the online education arm of the University of Massachusetts. They are an innovative partner with us and are integral to the work that we're about to talk to you about in Boston. So Reagan and Amy, good morning, and thank you for being here today.
Glad to be here. Thank you.
Hey, so we're going to jump in and we're going to kind of talk about some stuff to kind of give some background to this. And Reagan and I are going to engage in a bit of a Q&A, but just for background and context, like Chicago, like many places in the country, there are challenges in the healthcare workforce. There were shortage of qualified workers. If you think back to 2020 to 2023, we were coming out of a pandemic. We're coming out of a period of intense burnout for healthcare workers at all levels, including in allied health. And in Boston in particular, there's also the impact of underemployment in the city of Boston. And so as a result of those sort of factors, there was really this conceptualization of the Ready to Work program. And it really began initially as a collaboration between WeLearn CCI, UMass Global, and Mass General Brigham. And it was focused on providing no-cost short-term career training for advancement. So with that in mind, Reagan, before we kind of dive in, I know one of the things that we talked about with April in the run-up to this was the pilot part of the Ready to Work program with our partners at MGB. So can you share a little bit from the UMass Global side, the setup of that conversation with MGB and really how the pilot came about, and then we'll talk a bit more about some of the factors that led into the wider Ready to Work program.
Yeah, and I think you set a really good context for that. MGB kind of just has over 250 medical assistant roles that they need to fill kind of all the time. And they were really having a hard time getting that type of volume from the community college programs and even their internal training programs that they were running. And so we'd been partnered with them for a long time on the degree side. And so we started talking about, what are some things that we could do? And we engaged with CCI and WeLearn because of your, breadth of programming, and really dived into what is it that they need. And the pilot came about kind of in the background. The Good Jobs Challenge grant was being discussed, and we knew that we wanted to write to that grant. And so we wanted to really do this proof of concept. How can we kind of reach out to the masses, bring people into the healthcare space who hadn't been there before, and really show results in a short amount of time. So we're not talking about, a semester and then a semester of clinicals. We're talking about, an online program, labs, and getting them into the workforce quickly. And so MGB They're also very innovative in their thinking. And they said, yeah, let's do it. Let's do a pilot. And so they actually paid for 30 hires. And their requirement for this pilot was that once that employee was hired, they had to stay enrolled for 90 days. Um, and then we were paid after that placement. So I think that the willingness of CCI and WeLearn to really upfront those costs was a big, determining factor. The other great thing about the pilot was, after 6 months, we'd completed the pilot program. In the meantime, we had become a subrecipient of the Good Jobs Challenge grant. And so while other partners were, starting to think about their programming and develop their programming, we had this pipeline of people who were already ready to go just right into the grant. And so there were a lot of learnings from that, and it was really successful. And I would absolutely, do that type of funnel again. That really worked well.
Excellent. And I think, with that context, and we're going to dive in more detail on the Ready to Work program. But again, we came into this initially in an employer-funded model, transitioned into a grant-funded model as part of a Good Jobs Challenge grant in Boston. And we'll talk more about that. I think, again, in the background, right, we know that turnover for employers was biggest issue, and healthcare was not immune. And what I will share with you is that we did over in 2023 and in 2024, we updated this. We looked at the cost of turnover nationally in positions. And, while this covers more positions, we specifically focused on medical assistants and patient care technicians. So you can see even just the national turnover. And we also looked at the cost to replace the worker, right? So this is the backdrop of, both MGB's issue in Boston, underemployment in Boston. And then this is what we were seeing nationally as we've come into this program. So I want to talk, and Reagan, you talked a little bit about this. So, I want to talk about the program structure. And you talked about the funding for the Good Job Challenge grant. You talked about it being performance-based, particularly in the pilot with MGB. But I'd like you to talk a little bit about the funding structure in the grant even being performance-based, and just talk about the experience as the educational partner and from the employer partner perspective, because you manage that relationship directly with the employer. What has the experience in terms of the program structure?
Yeah, so we're a subrecipient of the Good Jobs Challenge grant. We are tasked with hiring 1,000 people into medical assistant and patient care tech roles. And so that the performance period of the grant is August of 22 to August of 25. So obviously with 1,000 hires that we need to get, we needed a really innovative method and model to achieve those outcomes. And so as you'll explain kind of the model of the Ready to Work program, but it really has kind of turned everything on its head. And, I think there's a lot of head scratching, like, can that really work? And so what we wanted to do was provide kind of a very easy way for the grant to say, yes, we will do this. And so again, just like the pilot, everything is upfront. And then we are paid once a candidate is enrolled for 30 days. And so there's no risk to the city of Boston and the funding. We're only paid once we place a candidate. And so that I think in and of itself is really attractive, specifically to grants, because they're not afraid to try something out, because we are assuming all of the risk. So I think the kind of this source, train, and place model that Ready to Work has created is really an innovative way to start closing those gaps and those needs for employers. So Sean, if you want to talk about kind of how you do that. I have to say I was skeptical, and then we just the numbers started rolling in, and it's really been exciting, because at some point you could kind of, I always say it's like, the boa constrictor who's eating the mouse, and you can see like the people coming through, and it's like, oh my gosh, at some point they're all going to be in like the applicant pipeline, and we're there now, and it's really exciting just to see the numbers kind of grow and grow and grow. Yeah, so talk about the model, because
This,
I'm a firm
yeah.
believer in it.
Yeah, you set this up. So what's great is in our model, again, we're recruiting from the community. So we created in conjunction with our partners at UMass Global and MGB, an Indeed recruitment ad that is invites individuals to apply into a job training program that is free to them, that is sponsored by the Good Job Challenge grant. That Indeed ad is monitored daily. We respond daily to candidates that apply to that. And when the candidates reply to, they're invited to apply to the program via registration page. We have a really simple registration page. We collect really 4 or 5 pieces of information: first name, last name, address, email address, and phone number. And what's great, and again, because we're trying to make this easy for folks in the community that are signing up for this, they get their credentials once they register immediately. They receive them on the screen. They get an email and they get a text message to the phone that they gave us when they registered. The program is hybrid. So there is and by the way, I'm realizing that I have some bullets swapped on the bottom, so I apologize for that. The career services and the learning program bullets are swapped, but the program is hybrid. So when we started the program, it was all online self-paced modules, and then there were hands-on labs. One of the benefits of the pilot period that we had with MGB, that Reagan talked about, is we were able to iterate. And so when we got through that first 6 months, we said we need to put some more here, and we embedded into the program 5 virtual instructor-led lectures that are really built to debrief key components of the curriculum. So in conjunction with the hands-on labs, we also launched national certification reviews. So we are really touching these learners who are moving through at their own pace multiple times. We do provide comprehensive career services. So we're doing resume development. We're doing application support. So we have career services representatives that get on the phone with candidates, that log in with the candidate to MGBs, or an employer's applicant tracking system. They make job applications on the phone with these candidates. We then report back every application that a candidate has made with one of our career advisors to our employer partners, so they know exactly which recs our candidates have applied to. We also do employer follow-up. So we are meeting on a regular basis with our partners at MGB and other employers in Boston to talk about the candidates who have applied to them, get candidate feedback, interact with candidates based on that feedback, and coach them based on feedback that we're receiving from our employer partners. I think that what we have seen, and to Reagan's point, is as the candidate pipeline increase, we've seen the speed at which candidates are moving through the program increase. I think when we first started this program, we saw people moving through the program in about 3 months. I think we're down to, on average, 2 months now. I think that we have seen our lab participation really grow. So our lab participation, we see on a typical lab weekend anywhere between 150 and 200 candidates in a weekend. And one of the things that we did as we moved through this program is, on the career services side, a lot of that was virtual. We now do a in-person career services day on the Friday before we run labs. And so on a career services day, we could see about 100 candidates on a Friday afternoon in Boston coming in to develop their applications, finalize their resume, et cetera.
And
So,
just to add on to another iteration that we just finalized this week. So candidates are already coming for Career Services Day on the Friday before the Saturday and Sunday labs. What we are now doing in these last few months of the grant is we are holding a job fair on that Friday as well. And so we're inviting, obviously, Mass General and because they're our main employer partner, but then we've also opened it up to other members of the healthcare consortium to attend that career fair, so the candidates can meet people face to face. We held a career fair in November, and the candidates and the recruiters were like, we have to do this again. And so, now that we're kind of in the last several months, we're like, we're going to do this every month just so that we can, get our 1,000 hires in.
That's a great point. And I want to talk a little bit about some of the outcomes to date. And so in the lifetime of this program, we've had over 18,000 people sign up for the program, which again, I think that when we started Reagan, and there were others that said, hey, what is this really going to look like? We've had over 18,000 people sign up for the program. At any given time, we have several thousand learners actively moving through the program. And to date, we've placed almost 750 individuals in Boston through this program. One of the things I'd like to ask Reagan to talk a little bit about is, because it came up in some of April's opening remarks about the diversity of candidates, about reaching underserved communities. Reagan, can you talk a little bit about what we've seen in terms of the candidate profile coming through? What are some of the stories that we've heard, and just about that aspect of it? Because that aspect was also super important to our work in Boston. It was super important to MGB. Talk about the diversity of the candidates that we see.
Yeah, so the city of Boston, one of the requirements that they had was that we really needed to reach BIPOC communities, and our demographic reporting is super intense, and so we made a real effort to do so. What we're seeing is we have a large population of immigrants. And for example, I spoke at a community event, and all of a sudden I was getting 30 or 40 emails a day from the Haitian community, and they were very interested in the program. And so what we're really seeing is pockets of immigrant communities who are coming through. They're talking to each other. They're attending labs together. We also have just a very sweet story. When I was at labs one time, there was a husband and wife who were refugees from Syria, and one was a surgeon, and the other, I want to say, a cardiologist, and the wife had gotten placed at MGB, and then the husband was there, and he was meeting with the blood donation center, and just they had this immediate connection, and they were talking. And so right after the job fair, he was hired as well. And so it was just this great story that they're not able to practice what they did in Syria, but here they are in healthcare. They were able to get in through the Good Jobs Challenge. And so we're seeing a lot of that. The other thing, for whatever reason, we had some leftover money in the budget, and we really wanted to make an impact. And so we are partnered with Catholic Charities of Boston, and we are piggybacking on their CNA program. And so they are going through this healthcare bridge. So they're going right from the CNA program into our patient care tech program through Ready to Work. And so they're getting that one-on-one support with their English from Catholic Charities in the healthcare context by taking the online program, attending the labs, and we have a pipeline. Somebody at MGB already works with Catholic Charities directly, and so we've made that connection as well. So we are funding 60 people through this ESOL Healthcare Bridge program that would not have gotten the opportunity otherwise because their waiting list is so incredibly long. We basically said to Catholic Charities, hey, we've got some money. Can we spend it with you? And they were, oh my goodness, this is, such a blessing. And so Sean, I actually haven't talked to you. I met with them this morning, and they started on January 10th. And we have someone already who is 91% of the way through the online program, another couple people who are like 85%, and they are intending to go to labs on March 8th and 9th, and they're going to attend the Career Services Day and Job Fair on March 7th. So super exciting.
Excellent.
Yeah. And so that is another way that we've really tried to reach kind of those underserved communities. And so it's a real value for us here at the university. And, plus, for Sean and I personally, I know. And so that's been something that we've been focusing on.
I love that. And we'll talk a little bit about I want to talk about some of the lessons learned and best practices. And I think, as you've kind of heard us talk, right? We have 18,000 learners who have come in here. We have at any given time, probably 2,000 or 3,000 active learners moving through the program. We have at any given time, several hundred individuals that are applying for jobs, multiple roles with a system like MGB. And so some of the things that we learned is that one of the things that we learned is that candidates will be candidates. And by the way, these are job seekers. And I think that one of the things that I think has been super fulfilling is to see that, we've taken the barriers of, in this case, funding for an educational program and time and place of showing up at a time and place at a regular basis out of the equation, other than showing up for labs. The candidates that we serve, they want jobs, they want to work. And so a couple of things that we found is, number one is candidates will be candidates, and the candidates that move through our program are going to try every avenue to get a job. And so one of the things that we found early on was sharing and validating data at scale and transparently was crucial. The other piece that we found that was super crucial was regular and open communication with all partners. So Reagan, one of the hallmarks of I think our partnership, and you really spearheaded this, was that we have a weekly a weekly meeting with MGB on all of the data. So do you want to talk about how we've done that? And I think in some ways you've shared with me that that's actually a little different than some of the other Good Jobs Challenge partnerships in Boston. So talk a little bit about that weekly communication cadence and what that means to the work that we do.
Yeah, it's a good point, because I think it's critical to have a very open and regular communication cadence with the employer partner, especially someone as big as MGB. So MGB is the largest employer in the state of Massachusetts. They're a massive system throughout the entire state. And so we actually meet weekly with their workforce development team. And so the three partners kind of every week talk through the data. Sean puts together a dashboard, kind of the numbers of where everyone is throughout the life cycle of the program. We follow up on individual candidate questions. We also talk through, again, ways to iterate, ways to improve the program. But I think the biggest thing, going back to Sean's comment about candidates will be candidates, we have a very prescribed process that we, kind of want and expect candidates to work through. But, you're looking for a job. You're not just, applying at one place. And so we kind of knew this anecdotally, like, we've got to have more hires than this. There are so many people who have completed our programs. Like, what happened? And we recognized that there was candidates would stop replying to outreach from MGB. They would stop replying from our outreach. And it was like, what is happening? And so we actually created a mechanism that we would follow up with those people, and found that we have over 100 people who actually are working outside of MGB. They found jobs elsewhere. And so we were able to capture that information, and we're able to report them toward the grant numbers, which has been great. And also, kind of affirming to us, because we were like, we knew that there were more people. Yep. But that's another thing, is that the workforce development team at MGB is so great, because what they will do is, once Sean's team sends the candidate information over to them, they actually have a core group of people who will directly reach out to the candidate and say, what are you interested in? You know, how can I help you? They'll kind of do a debrief with them. They'll reach out to the recruiters and say, hey, I just talked to this really great candidate. They applied for this role. And that's really important because, again, MGB is so huge. People get lost in the system. And we've tried to tag candidates in their LMS. It's been a bit of a challenge. MGB also just went through a big technology change. They moved into Workday, and so we had to navigate that. But we try to keep track of all of our candidates through the system. And so the team at MGB is critical in saying, they actually send out a Friday email. We're all super excited to get it. It says, these are the hires this week, you know, and this is where they are. And so that has been critical for us to keep track of all of the candidates going through. And then also with the reporting from the grant requirements. So when I talk to other partners with the Good Job Challenge in Boston, and they hear that we meet with the MGB team weekly, they're extremely jealous. A lot of them have a hard time, you know, kind of getting that employment verification back from the employer. And so that's been a great benefit that we have, is that MGB is so invested in this as well. And so I really don't know that it would work as seamlessly as it does without their partnership on this one.
Yeah. I think so, Reagan, thank you, because I think that's a great perspective. I'll add two things. So number one, I am super cool. I am not cool enough to create weekly dashboards. So I have an operational partner who does all of that work. And I don't want anyone to think that I take credit for that, because I'm not that cool. But the second piece I would just say, just about some of the data validation, and Reagan talked about the external validation that we did. The other thing that we've done with our employer partner is we've actually done a data bounce against enrollment data versus their hired system. And in some cases found hires that even the workforce development team wasn't aware of. So we also had that sort of large scale comparison of data that we were able to use with them in order to say, okay, who are the people that are getting hired that we don't know about, right? Because they've gone and applied on their own, that they haven't gone through that process that we've talked about. And so I think that that's also the super important thing, was we were able to go to the employer partner and say, hey, we need to kind of take a look at this globally, and how do we do this? And we put in together a process of how to do that sort of data validation and bounce the two lists across each other. So I think that's super, super important in terms of the willingness of the partner to really understand the impact of what we're doing. That actually brings us to Q&A in terms of questions. I want to make sure that we can take questions from the audience, and also make sure that I want to turn it over to my colleague, Amy Roberts, to share a little bit more about CCI and what we do. So what questions are there?
Sean, we have one in the chat. You had mentioned the turnover and cost to replace on that slide. Was that from existing research, or was that new research from Boston?
That was new research, and that's actually national research. So we did that research on the Ready to Work side in 2023. We knew from a perspective, we knew that we were solving a problem. We wanted to have some frame around what the frame of the problem was. So we did the first round of research in 2023. We refreshed it in 2024. We had a great analyst who actually works in the healthcare industry, who did the research study for us and went out and kind of looked nationally at the data and consolidated that data. So that's original research that we did initially in 23 and then again in 24. We've not looked in 25 yet.
Got it. That's really interesting research. I have one question for you before, Amy, I believe you have some slides to share as well. Is that correct?
Yep.
Sean, if you want to stop sharing yours. You had mentioned that 18,000 people have signed up and have started the program so far. That leads to 750 hires, and then more hires at other healthcare providers in and around Boston, which is great. I'm curious to hear, what about 17,000 others? Are a lot of people signing
Yeah.
up and starting and not going very far? Are
Great,
there a
great
lot of
question.
completers where you're not
Yeah.
sure if they have a job?
Yeah, great question. So I think there's a couple of things that are in that. So number one is, remember that this is an Indeed ad. And by the way, on Indeed, if you look at our Indeed ad in Boston, it says at the top of that ad, super responsive employer. So I think that one of the things that we do see is that there are a lot of folks that apply to that ad. They think it's as a job ad and they're just looking for a job. They're not necessarily looking for a training program. And so they get a response, they register for a training program, they get into the training program, and they're like, oh, that's not what I'm looking for. So we know there's a percentage of people that are doing that. And so we understand that. Now, one of the things that we are looking to understand better, and we've been iterating on, is as we review someone's resume as it comes in, if they look to be a qualified candidate, someone who maybe doesn't need to go through the education program, we're working to the best of our ability to get them connected to MGB and move them on. So they may have registered into the program, they may not have progressed. So we know that there's at some level, there are just people that sign up. We know that there are people similar to people who maybe, think they want to go back to school, they sign up for the program and then they go, oh, I can't do this right now. We know there's a percentage of that. I think on average, when we look at data at any given time, we have a good 3,000 or 4,000 active users, active learners moving through the program. We have a system of identifying learners, and so we have we may have 3,000 or 4,000 people actively going through the program at any given time. We have 1,000 learners that are probably the most close to application. They're the ones that we watch the most. They're higher in completion. They've shown up at labs. They've done instructor lectures. So we have a system of categorizing candidates and those that are closest inbound to application. So I think, as we continue to look at this population, and by the way, we in particular in Boston, but in other places nationally, we're looking to solve more of that engagement piece that you talked about. I think again, at scale, we know there's a lot of reasons why people come in. We know there's a lot of reasons why people don't persist. We're working to understand more of it and what can we do to better impact that. But I think again, from where we started in 2023, 2022 to where we are now, I mean, I think in the beginning, as Reagan said, there were a lot of people who were like, are we going to get these candidates? And I think now we're looking going, wow, we actually got them, and we see on the pipeline of how this is filled out and really what the inbound trajectories are. But it's a great question. And I think it's something that we as a company and as providers are constantly looking at how to crack that engagement code.
Great. And I might be teeing up what Amy is about to share. And again, encourage anyone to just pop off of come off mute if you want to ask a question or throw it in the chat. But I'm curious as to the relationship between We Learn and Condensed Curriculum International. And, are there these curriculums that are built out in patient care tech or surgical tech that someone in Chicago could say, hey, We Learn, we want to we want to train a bunch of medical assistants. How could we do that with you? Or Amy, how can Condensed Curriculum International build this program with us? So perhaps that's teeing you up, Amy.
The easy answer to that question, though, April, is yes. So there's a yes. There's a yes. So
That's a great
Amy,
answer.
and Amy, you're still on mute, so I'll let you continue, but the easy answer is yes.
Yeah, absolutely. So yeah, I'm Amy Roberts with Condensed Curriculum. I have attended a few of these events in the past. And so, it's nice to come on today as a presenter and just kind of continue to engage with the Chicago community, learning what you are doing, kind of in comparison to some of the other projects we have across the country. And but really just to talk right now a little bit about the training aspect of it. So as Sean said, at the front of the meeting, CCI was started in the 90s, was actually created by a pharmacist as a pharmacy technician training program. And we're still doing that today in the classroom, training pharmacy technicians, but over the years moved into other allied health programs and adopted the technology, of course, which, we have to do to keep up, with the demand of the employers and everything. So the three primary industries that we're targeting are healthcare, IT programs, skilled trades. We have other industries where we can offer full comprehensive career programs. And when I say the comprehensive career program, it really is giving the learner everything that they need from start to finish. There aren't necessarily prerequisites that they would have to take. Oops, sorry, I jumped ahead of myself a little. To be able to complete the program, and through the training and the support that CCI provides in partnership with WeLearn and then other institution and corporate partners, we're able to really provide the learner everything that they need to go all the way from day one of training to employment. Each of the programs that we offer maps to a national credential. Some may map to more than one, so the student can choose maybe the gold standard for their region if there are multiple options for national certification. But the training should provide them everything they need to confidently prepare for and sit for the exams. Going to jump to the types of training. So as I mentioned, we started in the classroom and we are still in the classrooms with traditional materials, but we've also expanded to really try to adapt to any of the needs or requests of our education partners. So, hybrid means 1,000 things. I feel like there are so many ways to accommodate learners now, and CCI steps right up to that. So, whether we want partially in the classroom and maybe a couple of Zoom sessions, or if we're working with a population of learners who are working full-time and they have children and, their availability and opportunity to learn is limited, then we can look at that and say, okay, how do we customize the delivery to really aim for the best outcomes for this group of learners? That comes from our relationships. And I think that you can see just in the conversation between Reagan and Sean here, when we partner, we dive deep into that partnership relationship, really learning how can we serve each other the best, understanding what our roles are to be able to come in and serve your learners the best we can. And then also learn, what are you doing that works? We may have resources available, but if you're already doing it and it's great, you don't have to use ours. Just figure out how our services and products can fit into your goals and roles in the workforce industry. And let me jump to the third delivery model. We have an LMS with asynchronous training, and utilizing the LMS allows us to make it completely flexible for the learners. They can stop whenever they want. And in lieu of having instructors assigned to the cohort, we have a full learner support team that is available to the students. So they're not just going to, receive a login and then never hear from anybody. They actually have a team behind them that will help to motivate them. If they're hung up somewhere, then we can kind of dig in and figure out how can we really help to get them across the finish line for the training. Excuse me. In addition to the content, we also provide all of the materials the students will need. And that may be lab supplies, it may be virtual labs and simulations, but based on the program, we've already rolled in everything the student will need to be able to successfully complete the training. We, when we're training in the classroom, we tap into our recruit team where we bring in instructors for our partners. And the instructors also have full CCI support. So they know how to use our content. They know how to serve the learners the best based on how the content was developed and using the materials. So we can come together with the full service package for delivery there. We manage all the reporting so that any of our partners know exactly where the students are. And I know, Reagan, you kind of got deep into that, how granular we can get in the data that we can share, the importance of the data, and then studying it. And like Sean said, really understanding the demographics, the partners, and the needs for a region or an industry so that we can make our training be as effective as possible. We're all across the country. So we have multiple partnerships Obviously the ready to work model is a fantastic model on the corporate side. But we also work with colleges and universities, large and small. The training we do with the institutions is on the non-credit side. We're working with those workforce development, professional development, continuing ed departments to offer this training, get the students in the door, out the door, and in the workforce very, very quickly. We work with community action agencies, again, big and small. Some of them may be agencies that you're very familiar with. Other agencies may be in a small rural area and they're supporting a very targeted demographic. And our partnership relationship with them allows us to understand, who are you serving, how are you serving them, and to deliver the training with whatever resources we have, like I mentioned a couple of minutes ago. So although we have very strategically outlined standards for the training, we have the ability to customize it based on whatever the needs may be for our partners. And then the third partnership is corporate, and that can look like Ready to Work. It can look like an employer-sponsored training program for incumbent workers. It really can have a lot of faces there for the corporate training. So like Sean said, we say yes. When given an opportunity to partner with somebody, we really just want to understand how can we come across as the best partner using the resources and materials, content that we have available to support the employers, education, the institutions and agencies on that end. So that's kind of a big, in a nutshell, of what we're doing across the country. But chances are you may have come in contact with us at some point. It just didn't have our name on it, because most of what we're doing is branded to our school partners, our agency partners, our corporate partners. So we don't always have to have our name right on the front of what we're doing. And then I wanted to just share some other numbers. I think my screen's off there a little bit. So the school partnership, like I said, we have over 500 school partners, and these can be major universities, community colleges, adult learning centers. We will deliver wherever we can deliver to fulfill the needs of the employers in the area. Over the years, we have, outside of the Ready to Work model, we have worked with thousands of employers to place the learners in externships. And the success of Ready to Work has actually allowed us to shift now where we're not just placing the learners for externship as they come out of our schools, but we're giving them the job placement opportunity, those learners who are just ready to connect with the employer. And they can tap into the same resources that Sean shared in terms of resume building and coaching, preparing them for the connection that we can make with the employers. And then the placements, that's a huge number, and that's a different number than Ready to Work because, in Boston, that's one project. But, the impact that we've had nationwide, because often the students who are placed in an externship, they may finish the externship on Friday and start Monday as a paid employee. And so, there are multiple benefits there where they've had the opportunity for the hands-on experience that they really felt they needed to get. But also they were able to learn the culture and, see, what, I am a great fit here. My employer wants me and I really want to be here too. So, so the externship component has been very helpful and important for employers, students, and us. We depend so heavily on those employer relationships to be able to connect the students.
And Amy,
yeah,
the thing I would add here is that piece there, like all of this here that you see, which is the history on which CCI is built, is what actually enables us to do what we did for Ready to Work. The fact that we have that 20,000 placements, which is separate from what we did what we reported in Boston, that 20,000 placements is for learners across the country in local communities where they live. It is the local pharmacy down the street that they wanted to work at, or the local physician's practice. That is a level of work that we do in communities across the country that enables us to do what we do in Boston and in other places when it comes to the Ready to Work model. So I think that's just super important to call out that this is, this is not a new competency for us. it is an expanded focus for something that we've done for a number of years, and have done again in communities large and small across the country.
Yes, way to drive that one home. Because really, at the end of the day, what we want is for these learners to be employed. Give the employers what they need, and that's what keeps our communities going. So, and then just the number of courses. We don't offer 1,200 career placement courses, but what we do have is so much content that is used to build these career that we can break them down into micro courses to really customize what the employer is offering. So if you look on our website and you see the career programs and you're like, that's not really what we need, there's a good chance that a conversation with us will allow us to kind of dive deeper into that and potentially either break apart what's currently there and take out what you don't need, or tap into our development team to be able to customize the training for you. So that's the end of my share. And does anybody have any questions for me about CCI?
Thank you so much. Does anyone have a question? Feel free, raise your hand, put on your camera, and I'll see you. Go off mute. I know we only have a few minutes left. I'll ask a final question to Reagan. If any of our partners here are thinking to themselves, wow, this is an incredible opportunity to meet my my needs in medical assisting or patient care tech, and to provide an opportunity for Chicagoans. I know that you, Reagan, have a lot of different partners that you and your partners in Boston could work with, and probably have worked with others. If someone in Chicago is wondering, why should I work with CCI? Why should I work with WeLearn? What would you tell them?
The depth of partnership was brought up, and that's true. Sean and I, we have a standing meeting outside of our meeting with MGB. We text every day. We probably email each other 5 times a day. I mean, it gets a little silly at some point, like how tightly connected we are. My entire family knows who Sean is, it's that kind of partnership where I'm just like, hey, I need this. And Sean's like, boom, done. Right. I'm not waiting on things. I'm not wondering about things. If there's something that comes up and it's like, we gotta figure this out. This isn't quite working right. It's a really kind of heads together, figuring out what's going to be best. And I have to say that honestly, when Amy says we want people to get jobs, like, that is the truth. We've had a number of people who were hired through and funded through the grant, and then they've come back and they said, hey, I want to do something else. And Sean's team has helped them find another job, and not getting paid for it. No, absolutely, no funding. It's just like the right thing to do, and they want to help. And that kind of authenticity, is something that you can't fake. And, that's been really important for us. I mean, especially it's a 3-year grant, and we actually have applied for a 1-year extension that we haven't heard about yet. So, when you're working with somebody for that long, it's got to be a really close partnership. And I'm just so thankful that it is, and that, we feel very strongly that we selected the right partner for this.
That's great to hear. Thank you so much. Any burning questions? I know we have 1 minute. Amy has put in the link to the CCI contact page. I will send everyone who is registered this recording as well as the slide deck tomorrow. And on that email, I'll CC Sean and Amy so that you can just easily reply and reach out to them to set up a meeting to learn more about what they do or how you could partner. I hope to see a program like this in Chicago sometime soon. So thank you so much, Sean and Amy. Thank you so much, Reagan, for sharing your lived experience in Boston. I really appreciate it. And thank you everyone for joining. I hope to see you all at our next learning event next week or at our March 4th quarterly meeting. If you're in Chicago, stay warm out there. Thank you.
Absolutely.
April.
Thank you.
Great.
April,
you.
thank you so much. And
Take care. Bye-bye.
thanks.